Hi, I am Liam. I'm a student nurse at St. Elizabeth, and I'm going to be providing stroke awareness and background information about different types of strokes. And I'm going to be one of the nurses helping to do the assessment about warning signs for strokes.
Hi, I'm Nate. I'm going to be going over the BFAST assessment for a stroke, and I'm going to be one of the nurses in the assessment.
I'm Kevin, and I'll be doing stroke facts, stroke prevention, and being the patient for a stroke.
This video is meant for people that have family members of a person over the age of 35 that have any of the risk factors of a stroke, including but not limited to smokers, alcoholics, high blood pressure, obesity, and diabetes. So I'm going to be covering stroke awareness and background information. So a definition of a stroke is a brain attack that will be a blockage of the blood supply to the brain, or the blocked blood vessels will burst and then part of the brain will be damaged or die. When this happens, oxygen will not be able to circulate to the brain, and then cells will begin to die, which then causes the stroke to happen. This is a cardiovascular disease, and there are two types of strokes. First is the ischemic stroke, which is the most common one that happens in 87% of people, and it occurs due to a blood clot or blocked blood vessel to the brain, which causes the oxygen to die, as we covered before. The second type will which be a hemorrhagic stroke. The blood vessel will burst, which causes the rupture or leakage of blood to the brain, and this puts pressure on the brain, which then causes damage. So we have a warning stroke, which is a transient ischemic attack, which is a warning sign of having a stroke in the future. 10 to 15% of major strokes will happen within 3 months of having this type of stroke. Conditions that increase the risk for stroke is a high blood pressure is a leading cause, high cholesterol, heart disease, obesity. These all are linked together usually, and then there's genetic and family history that can be linked to conditions that have a stroke, and then drinking a lot of alcohol, living sedentary lifestyle, which means you're not moving around, not exercising, just sitting around, tobacco use, which includes smoking or usage of nicotine, and then diet, which is eating non-healthy food, which are high in fats, cholesterol, unsaturated fats. Strokes are more common in women, and then the older you are, the more likely it is to happen.
So here are the stroke facts. So stroke is the leading cause of death in the US. 1 in 6 deaths are from strokes. 800,000 people have a stroke in the US every year. The main culprit of this would be the stroke belt, which is consistent of Mississippi, Georgia, and it's around 178 people per every 100,000. So the risk factors for a stroke is high blood pressure, cholesterol, smoking, obesity, and diabetes. So about 1 in 3 adults are in danger of having a stroke. And for prevention, we would like to maintain a healthy diet, low blood pressure and cholesterol, live active, and stop smoking.
Alright, so this is the BFAST assessment for a stroke. So first you want to check for balance, if they're swaying or if they can't get up. Next you want to look for the eyes, is one eye drooping. And then the face, you're going to have to ask the person to smile and see if one side of their mouth stays drooping and the other side is able to smile. The arms, you're going to ask the person to raise their both arms, and if one arm has muscle weakness or starts to fall. And then speech, do they have slurred speech? And then time is of the essence, and every second counts. Today we're going to be going over the BFAST assessment for a stroke. The first part of this is B, which is for balance. You're going to be looking for any loss of balance or dizziness. Have you experienced any loss of balance or dizziness recently?
No.
Could you get up and walk to the door in the back of me? As you can see, he has a steady gait. He's not swaying back and forth. His arms swing in opposition. And there's no loss of balance. E stands for eyes, so you're going to be looking for any drooping of the eyes and asking the client if they have any double vision, blurry vision, or anything like that. So, have you had any blurry vision recently?
No.
Have you had any double vision or spots in your eyes? Alright, next is F, which we're going to be looking at the facial features. So you're going to see if the client has any numbness in his face, and you're going to ask them to smile. And see if they can smile or if one side of the mouth is drooping. So, do you have any numbness in your face?
No.
Can you smile for me? As you can see, the client, both sides of his mouth come up. If only one side would come up and the other side would droop, that's an indication of a stroke. Next is A, which will be observing the arms, and you look for any muscle weakness, numbness, or any drooping in the arms. So, have you had any weakness in your arms? Have you had any numbness in your arms?
No.
Can you lift your arms over your head for me? So both arms come up bilaterally, and if one arm would start to droop down as the other one stays up, that's a telltale sign of a stroke. Next is S, which stands for speech. So you're looking for any slurred speech or impaired cognitive ability, if they're having any trouble understanding what you're trying to ask them. So, what is your name?
My name's Kevin.
And what's your date of birth?
My birthday's February 20th.
And where are you?
I'm in the lab.
So you had no slurred speech and was able to understand all the questions I was asking. T is the last letter, which stands for time. Time is of the essence when stroke. So you're gonna have to note the time when you saw any of these symptoms starting, and be sure to call 911 if any of these symptoms do arise in your patient. This is the BFAST assessment, and noting any of these signs and symptoms can prevent the stroke to leading to further and irreversible disability. Strokes are a leading cause of disability in adults, and the BFAST assessment can prevent this disability from being a lifelong impairment and help to get the person the help they need as fast as possible.
This is going to conclude our presentation, and now if you have any questions, feel free to ask. And always remember, be fast.